I wanted to do a video on cardiovascular disease. It's a tough one to talk about. There's so much research. And there's so many ways to tackle a video about cardiovascular disease. For example, the heart position, the rib cage, where the heart is positioned in there, where the lungs are positioned, the muscles, how the rib cage is. Is there, anatomically speaking, are we breathing okay? Right? Is our rib cage being pulled down and in by our muscles? And is that are the organs, are the heart and lungs in the right position to do their job? Do they feel okay in there? Do they feel free to do their work? Something we don't really think about is organ position because of muscle tension, especially around the rib cage. So, just something I'd start with because you got to start somewhere. But I have got a 5-page document over here by my side about the cardiovascular system, and I'm not going to go in long term about this, but what this document is hopefully giving you enough to go and seek more information. So this video, I chose to make it about helping you ask questions. So, what are the common types of cardiovascular disease? Okay, you got your coronary artery disease, right? So hardening of the arteries. You've got your heart attack, which is your myocardial infarction, your MI. You've got your abnormal heart rhythm, your arrhythmia. You got heart failure, angina. Cardiomyopathy, enlarged heart, usually the left ventricle. You got aortic disease. That can be Marfan syndrome. That could be due to hardening of the arteries. Vascular disease, stroke. TIA, transient ischemic attack. Prince-Meadows angina, which is a vasospasmic angina. That's a little bit different. It's almost in a different category than the other ones. So what are some signs of heart attack? Oh, don't we love talking about this? There's a really great video on YouTube about this. That's like, if you have a hard time looking at this and it's scary, this video is fantastic. So just a fun, not fun, but just maybe a little easier way to look at it. But anyway, okay, I'm just going to go really quick. Chest, arms, neck, jaw, or back. Pressure, tightness, pain, squeezing, aching, nausea, indigestion, heartburn, abdominal pain, shortness of breath, cold sweat or sudden change in body temperature, fatigue, lightheaded, suddenly dizzy. All of that sounds really familiar, and it looks like other things, doesn't it? It looks like other things, yes. So it's going to be your instinct. It's going to be your instinct that guides you. Use your inner compass. What's going on? Does something feel really wrong? Something not right? And that's your answer right there. If something's in there going, no, it's not right, and you need to get your kid to send you to, or whoever is around, like, to help you, do it. If loved ones, probably the most common symptom of a heart attack is denial. Okay? So, symptoms of severely high blood pressure, severe fatigue, headache, confusion, vision problems, chest pain, difficulty breathing, irregular heartbeat, blood in the urine, pounding in the chest or neck or ears. There's this woof, 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 and you're red-faced. So, stress hormones. I see 2 different kinds of blood pressure when I take blood pressure. It's not when I don't see it in the blood pressure on the measurement. I see it in the patient. I see cardiovascular blood pressure, and I see stress blood pressure. And that's what I like to define it as, 2 different things: cardiovascular blood pressure or stress blood pressure. So, stress hormones can contribute to high blood pressure. That's your cortisol. It's also your adrenaline. The fight or flight response. Sometimes it's a great big huge fight or flight response, or maybe it's like a low grade, didn't even notice I was wound up kind of flight response. But you kind of look at yourself and go, okay, what gear is my body in? Am I in neutral? Am I in 3rd gear? Am I in 6th gear? Maybe I need to just go and gear down. Sit down and have some herbal tea. There's many, many ways to manage stress. And some works for some, and some don't work for others. So if deep breathing doesn't work for you, it's okay. It doesn't work for everybody. We'd have to figure out what's going to work for you. We'd have to have that conversation. We'll figure it out. We'll get creative. We'll do some detective work. We'll figure it out. So stress management, different for everybody. So, what are the symptoms of low blood pressure? Dizzy, lightheaded, nausea, faint feelings, weakness, fatigue, thirst, feeling dehydrated, can't concentrate, fuzzy brain, just can't get it together, blurry vision, room tilting, sort of like a cold, clammy, pale skin, chilled, feeling chilly, rapid, slow breathing. And so I see a lot of low blood pressure, actually. I do. I see a lot of low blood pressure, and I see a lot of low blood pressure in people who are taking blood pressure medications. Because sometimes, at certain times of the day, blood pressure is really high, and that needs to be controlled. But at other parts of the day, that blood pressure is not as high. And so sometimes I see low blood pressure at certain times of the day. So put a pin in that, go look, be aware, ask questions. So, among other things, people with high blood pressure want to watch out for the following herbs. Licorice root. Licorice flavor is usually fine. That's usually anise. It's not usually liquor, but if licorice root, real genuine good stuff, just know it can increase blood pressure. So if you already have high blood pressure, maybe not the best choice. Okay, caffeine. So what's caffeine in? Coffee, black tea, oolong tea, Earl Grey tea, green tea, white tea, and maca tea. Oh, and matcha tea as well, which is another form of green tea. Yeah, those have caffeine. Maca has caffeine in it. Little known fact. Didn't know that till I looked it up. Ephedrine. Pseudoephedrine. Where do you find pseudoephedrine? You find that in nasal sprays, in allergy medication. Pseudoephedrine. Watch it. Sudafed, right? Pseudoephedrine. Ephedrine. Very, very, very stimulating. It's like coffee times 3. That's what ephedrine is. Tribulus. Tribulus terrestris is, in my opinion, you want to be careful with. And it's just my opinion. Just because I think that Tribulus, it's a men's health herb. And I caution my people who have high blood pressure that can't seem to, like, stubbornly high blood pressure and it's not down. Just watch it with the Tribulus. Maybe not the right one. You'd have to find out. Just ask questions. Okay, medications. Are you ready for this? Okay, so there's a group of medications that you want to be aware of, and that's NSAIDs, non-steroidal anti-inflammatory drugs. Okay, NSAIDs. So examples of NSAIDs would be like aspirin, which I know, like, your doctor is on it with aspirin. So Celebrex, acetaminophen, Tylenol, right? Voltaren. Not the stuff that you rub on, that's fine, but the stuff that you take. Motrin, Advil, which would be ibuprofen, Aleve, naproxen, which is also called naproxen. Those are examples. There's tons of NSAIDs out on the market. So the reason why these have significance is because they do have significance with regard to the liver and kidneys, with gastrointestinal bleeding, with stomach ulcers, and interactions with other medications. There's a lot of them. So I guess the thing here, and this is straight from the pharmacology textbook, the primary care pharmacology for Canada, the compendium of therapeutic choices. That's straight from there. So just the take-home message with NSAIDs is, if you're taking an over-the-counter pain medication or headache medication or allergy medication or something like that, just make sure your medical doctor or nurse practitioner or specialist knows you're taking that. Okay, even if it's not every single day, because they need to know if there's interaction potential, because then that's going to help them choose the right medications for you. Okay, so what kind of medications do we take when we have cardiovascular disease? What do we get prescribed? Well, ACE inhibitors are one of them. ACE inhibitors, it's a group of medications. So, Altace, Mavic, Acupril, Acheon, Zestril, Prinavil, Vasotec, Lotensin, those types of things. Common adverse effects, dry cough. Headache, altered taste, dizziness, rash, swelling, low blood pressure, low blood pressure. Your urine, kidney stuff, potassium. Watch it with the potassium when you're on some cardiovascular medications. And I'm sure you've heard that from your doctor or your nutritionist or your nurse practitioner. So pay attention to that one. Pay attention to the word potassium and pay attention to low blood pressure. ARBs. These are angiotensin 2 receptor blockers, ARBs. They're kind of similar to the ACE inhibitors. They have a similar mechanism of action. They have a similar personality in terms of what they do for us, but they don't have that dry cough associated with it. So it really is a sort of a matter of like how we're wired, how we're put together, and what medication is going to work best for us. Again, potassium. Okay, watch it with the potassium. You don't want to be taking potassium supplements if you're taking those two medication groups. Okay? Don't be doing that. Beta blockers. It's like, you know, oh gosh, brain fart. And things like Sectrol, Tenormin, Zbeta, Lopressor, Toprol, Corgars, Bistolic, Inderol, Inopran. There's first names and last names for medications. There's the scientific name that's sort of attached to the group, and that's where the doctors know that stuff. And then there's the common name, which they give to the patient. So these names are, but you can easily look this stuff up, right? Propranolol, stuff like that. Anyway, so the most common adverse effect with the beta blockers is the low blood pressure. There can be appetite changes. There can be Raynaud's phenomenon, which is where you're getting like purplish or just like not very good circulation in your fingers, and they get really cold to the point where they hurt. That's Raynaud's. Let your doctor know if that's happening. They interact with a few things. Beta blockers, they do. They interact with a few things. Erectile dysfunction medications, be careful. Make sure your doctor knows you're taking erectile dysfunction medications. You don't want to take beta blockers. You don't want to stop them abruptly. Okay? Abruptly stopping a beta blocker could cause rebound high blood pressure or worsening ischemia. So those are big words, but just a basic, if you're on a beta blocker, don't just be like, I'm going to stop taking my medications and stop taking that. You want to ease off that thing. So work with your doctor. Calcium channel blockers. So Norvasc, Cardizem, Tyzac, Adalat, etc. Procardia, Valerian, Callan. Those are calcium channel blockers. This is another group of medications. You're going to see that, especially if you or someone you know has had a heart attack, you're going to be on a combination of these things. So most common adverse effect is constipation, low blood pressure. You might get some headache and dizziness, but that could be from the low blood pressure as well. So watch it. And just if you're having any swelling in your ankles, just let your doctor know. It might be fine, but just let your doctor know. And especially if you're getting puffiness around the face when you start taking medication, let your doctor or nurse practitioner know, or naturopath. All right. You know what you need to be careful here with this one? Grapefruit. Have you heard of this? Yes, grapefruit. And I'm serious. I am serious. Grapefruit juice. No. Grapefruit seed oil? No. Grapefruit essential oil? No. No. Okay, diuretics. These are water. They traditionally called water pills. Primary care providers don't really like that they're called that anymore, but that's what that's what they're familiar. So furosemide, Demodex, Butamide, Bumex, ethacrynic acid, Adequan, Lasix. Most common adverse effect, I suppose, dehydration, but again, potassium. You got to watch the potassium because some water pills, diuretics, will increase potassium levels and some will decrease it in the body. And either way, you don't want high potassium and you don't want low potassium. That's one you want to keep nice and steady. So you just talk to your doctor about your potassium and make sure you're not taking potassium supplements by mistake. And if you are, make sure that your naturopath knows the medications that you're taking. What else can I say about that? Calcium levels, again, calcium supplements, and that's the thing, right? We're aging, and so we're taking bone formulas, and we're taking medications for cardiovascular disease and all this other stuff, and so you just want to make sure that your doctor is in the loop, right? Your nurse practitioner, your doctor knows exactly what you're doing because they might know something you don't. Because calcium with some of these medications is also something significant. And things can easily go out of whack, which can cause some symptoms that are pretty severe that you don't need to be having at all. So just be smart about your supplements. That's why it's so important to work with somebody who knows this stuff. Because it's big. All these medications are so complicated, and the diseases are so complicated, especially this day and age. We've got so many wonderful medications and so much technology that we got to be on the ball. Okay, thiazides. Again, another diuretic. Same lecture. Potassium-sparing diuretics. Same lecture. Spironolactones, aldosterone agonists. Same lecture. Gentlemen, if you're developing breasts, let your doctor know. It's a side effect. Blood thinners. If you're on a blood thinner, get a naturopath. If you want to take supplements, if you are on a blood thinner and enjoy going to health food stores and looking at supplements, get a naturopath. Because there are a lot of things that blood thinners interact with. And just because it says natural on the bottle doesn't mean it's not going to interact with a medication and cause you some big problems. So be careful. Okay? Cholesterol medications. These are your HMG-CoA reductase inhibitors, your fibrates, and your resins, right? So that's your cholesterol pill, your statins, etc. Grapefruit seed extract decreases their effect and may impair the ability to absorb other medications. Also, some of these cholesterol medications will deplete coenzyme Q10. Coenzyme Q10. So you've probably heard of that term before, coenzyme Q10. Alpha agonists. These are, I don't understand these quite as well as the other ones, and I don't see these quite as often as I see the other ones on a patient medication list. So alpha agonists, they're for high blood pressure, and they're also for prostate disease. You'll see medications being used for different, for a combination of things. They tend not to be the first prescribed for high blood pressure, and your doctor is likely going to increase that dose slowly. And so this is a really great example of why you take a pad and paper in to your doctor's office and you ask the questions and make sure you're very clear on what the doctor's saying, even if they're in a rush. Sometimes they get really fast. I get really fast too, but I do want to make sure my patients understand what's going on. So it's up to my patient to be like, hey, focus. Stop talking so fast and just give me a minute. And oh, sorry. Because common adverse effects are low blood pressure. If you're taking too much too quickly, you can collapse, like you get really low blood pressure and fall. You don't want to have a fall. Headaches, which are no fun. Maybe drowsiness, palpitations, and actually some nasal congestion, but that's fairly common. But if you feel faint when you start taking this, definitely let your doctor know. So this in a very, very, very quick nutshell, 18 minutes long, is the medications for cardiovascular disease and I guess the highlights of it. So nobody likes to talk about this stuff, but the more you know, the more empowered you are, right? Use this knowledge and see it as power. Knowledge is power. The more you know, the more you understand, the better you can advocate, the better you can take care of yourself and your loved ones, and the better you can help others to understand. So if you are able and have the mental capacity or the education levels and the language to be able to read about this stuff, do it. Go ask questions. Get curious about it. Get a circle of care if you don't have one. Nurse practitioner, medical doctor, specialist, naturopath. We like to work together. At least most of us do. And it's really works well when we're all working together. Okay, that's all I have to say. I'm going to stop stammering. Hopefully that was helpful. This is not recommendation. This is information to get you curious, to go know where to ask questions and learn more about what you're interested in and what's relevant to you and your loved ones. Take care.